Hi, I'm Dr. Brian Koffman, a retired family doctor and clinical professor, a CLL patient myself for the last 20 years, and the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm here to talk to you about some news and important circumstances for CLL patients to understand. And in this case, the circumstances I'm talking about are giving a historical perspective to CLL and how it's evolved in terms of our understanding and its treatment. And it revolves around one individual who passed last year. I've entitled it Remembering Jacques-Louis Binet, 1932 to 2024, a CLL Pioneer. To put this in context, until recently, researching CLL was a poor choice, a dead end for a hematologist's career. But Dr. Binet and Dr. Kanti Rai changed that with their staging of CLL and what followed afterwards. Their staging began to organize thinking around CLL and help sort out the wide heterogeneity or differences seen in the outcomes of many CLL patients. CLL became more predictable, more sortable, and therefore more accessible to researchers. I'm going to share a comparison of the two staging systems, which you'll find in the article, for chronic lymphocytic leukemia. Remember, both systems were developed before there was molecular and genomic testing, so things like deletion 17p or unmutated IGHV are not included. But both systems remain in use today and remain useful, especially for prognosis in untreated patients. Let's look at the timeline. Dr. Rai's system came first, 1975 in the USA. Kanti Rai, out of Long Island Jewish, and his colleagues published a staging system in blood that stratified CLL based on the number of lymphocytes, the lymph nodes, the spleen, the liver, anemia, and the platelets. 6 years later, in 1981, there was the Binet system, which is mostly used today in France and Europe. Jacques-Louis Binet and his colleagues published their simpler system in cancer, focusing on the number of involved lymphoid areas and the presence of anemia or low platelets. Let's look at the two systems. We'll start with the Rai system. So 1975, Kanti Rai, low risk category was stage 0. And that's only where the lymphocyte count was elevated. The medical term for that is lymphocytosis. Stage 2, lymphocytosis and enlarged nodes, that's the intermediate risk. Stage 3, an enlarged liver or an enlarged spleen. That's respectively called hepatomegalia and or splenomegalia. Stage 3, anemia. Now we're moved out of the intermediate phase, intermediate risk into the high risk. In stage 4, the highest risk, low platelets or thrombocytopenia. The Binet system is easier and only has 3 stages, A, B, and C. Stage A is less than 3 lymphoid areas involved. So that could be like the neck, in the axilla or armpits, but there's no anemia and no low platelets. Stage B is more than 3 areas involved, but no anemia or low platelets. And stage C is anemia or low platelets, regardless of the number of nodal areas that are involved. The genius of their observation and their clinical relevance is what made this staging system so useful to this very day. These were the days before there was flow cytometry and genetic testing, days when physicians had to rely solely on their diagnostic acumen in managing their patients. Days before there really was a test before treat that has become so critical now. Dr. Binet passed last year at the age of 92. I had the pleasure of meeting him late in his life. Dr. Rai is still as sharp as ever in his 90s, but his impaired mobility limits his ability to practice medicine. He saw his last patient in August of 2025, I consulted with him at Long Island Jewish early in my CLL career, and we've remained friends ever since. He's a wonderful doctor. The CLL community is diminished by his retirement. An era is passing. I give a link to a wonderful remembrance that Dr. Tom Kipps wrote of Dr. Binet, closing with this line: with his passing, hematology is not widowed, but orphaned. Thanks for listening. We're entering a new era in CLL research and management, but we're doing it because of the pioneering work of people like Drs. Binet and Rai.